Jeyanthi, you might like to introduce yourself today and tell us your story. I want to hear the human stories of how they've been affected by this whole COVID debacle over these last few years. So over to you.
Thank you very much, Russell, and thank you again for having me. I'm really honored to have this conversation. So my name is Dr. Jeyanthi Kunadhasan. I'm an anaesthetist and I'm a peri-operative physician. I've trained in Malaysia, the United Kingdom, and I have more than a decade's experience in Australia as an anaesthetist and a peri-operative physician. I was a staff specialist at a Victorian regional hospital, and I got fired over COVID-19 vaccine mandates. I was a senior doctor in hospital, in my regional hospital medical leadership. And I was also, because of my clinical interest and my area of specialization was patient blood management, in which we reduced unnecessary blood transfusion. I was actually chair of the advisory committee for Blood Matters Victoria. So I got fired in December 2021 when I repeatedly asked my previous employer for a risk assessment and that I could not give valid informed consent to the COVID-19 vaccine because I had serious concerns. As a senior doctor who had attended board meetings with hospital leadership over the past, like at least for 3 years, I thought that, my concerns about this would be heard, and it repeatedly fell on deaf ears. And they told me basically that I couldn't fulfill in the inherent requirements of my role, and I got fired. So
what do they mean by you couldn't fulfill the inherent requirements of your role?
So if I could not provide a valid COVID-19 vaccine certificate of immunization, I was deemed that I could not fulfill the inherent requirements of my role as a consultant anesthetist. And you have to understand, Russell, as a consultant anesthetist, I turned up for work every day during the pandemic. I turned up for work even when we didn't have masks on. And you have to understand, as a consultant anesthetist, I was in way more higher risk of getting COVID than anyone who was in the line of decision making to fire me. I was a frontline worker. I never asked for anything special. I turned up for work. I read the medical protocols. I was prepared to do whatever it took to make sure that I was a safe practicing anesthetist. I never transmitted the disease to my patients, nor to my colleagues. And I had a plan if I were to get sick, what to do. So I was always going to be a safe anesthetist. I was not going to transmit anything in the workplace, either to my patients or to my colleagues. And
have you had COVID?
So I didn't have COVID until the last 6 months. I was sick for half a day, and that was only because I was so right now in Victoria. So I didn't get COVID basically for 2 years when I was, before I was fired, 2 years after I was fired. In Victoria, healthcare workers still cannot work. But if you have COVID, you can get a certificate to prove that you've had previous immunization, and then for short periods of time you're able to work. So if you get sick with COVID, you're able to prove that you've had an infection, you can work. So I was getting, I've been living off my savings. So I was, it's not for anyone to just live off their savings in perpetuity. So I sort of ran myself down and tried to get sick to be able to work. So that was when I got sick, and then but I mean, right now the way I look at it, in Victoria, healthcare workers still cannot work, but in other states, still in Australia, I'm able to work without needing to get sick every 6 months. So that is an option available to healthcare workers in Victoria and still affected by vaccine mandates.
So you'd have natural immunity, would you not?
I should have, yeah, because I haven't been touch wood. Yeah. I've been, I go for walks. My vitamin D is good. I eat well. And I should have natural immunity. It's not as if I cloistered myself in the house to avoid the infection. As I said, I turned up for work never asking for anything special. I was always ready, willing, and able to work. And I had serious concerns about the safety and the efficacy. And I had really serious concerns about the ethical transgressions that I think the medical profession gave permission to. And that was the reason why I did what I did. And,
And do you think the hospital will pay you any compensation for
well,
dismissing you?
so we had a human rights, we took our cases to the Human Rights Council, but you must understand, I didn't say that I was sick. I was always fighting. I was really stressed. I was very traumatized. But I fought it on the fact that I was asking for a risk assessment. So I didn't have like a disability in something. So the Human Rights Commission in Victoria has basically said they've rejected my case. And we are having some plans to further this issue amongst the Australian Medical Professionals Society, which is the alternative union for doctors. But it's still it's not something we want to really talk about yet, because we're still developing it. Yeah.
Are you going back to the Australian Human Rights Commission?
We have no avenue to go to them, so we have to go to VCAT.
Right.
Yeah. They basically rejected us. So it is what it is. It is the state of human rights in Victoria. So I am unable to now have to work in my occupation. So I have anesthetic degrees from Malaysia and Australia. So I'm pretty trained as an anesthetist. I've anesthetized in 3 continents, but I can't, for the life of me, do anesthetics in Victoria unless I get sick with COVID, which is interesting, isn't it?
You'll have to explain that to me another time. Having to get sick to get a job.
Yeah.
But you can work in every other state, every other state except
Victoria and New South Wales.
Well, there might be some good news on the horizon for you in New South Wales very shortly. But I wouldn't like to lose you from Victoria to New South Wales. But if that's what has to be, that's what has to be. So grateful for you coming on the show. I wish you all the best. I'm sad about what has happened to you and many of your colleagues. And I wish the Australian Medical Professional Society all the very best in their endeavours.
Thank you very much, Russell.
Thank you, Jeyanthi.
Thank you.